HIV/AIDS in New York City by Lena Sanchez. Your best quote that reflects your approach: "It's one small step for man and one giant leap for mankind," by Neil Armstrong. Background of HIV outbreak in New York City. New York City was affected by AIDS epidemic of the 1980s more than any other U.S. city. The AIDS epidemic has been and continues to be highly localized due to a number of complex social cultural factors that affect the interaction of populous communities that inhabit New York City. During the 1980s epidemic, the largest presence of gay community promoted local medical practitioners to take note of and respond to observed patterns of reported elements early on. Widespread fear and panic about the epidemic were combated by efforts of community activists and local government policies that were at some times supportive and at other times damaging or ineffectual. Improvements of both drug therapies and prevention education had led to a decreased number of AIDS cases. In June 2014, New York Governor Andrew Cuomo announced a new strategy designed to end the epidemic in the state through a combination of increased HIV screening and testing, promotion of pre-exposed prophylaxis, and improved linkage and retention in clinical care for HIV-positive persons. 2 years later, the New York City Department of Health and Mental Hygiene reported a decline in new infections of nearly 8% annually, or approximately 15% since the campaign launched. In 1981, in New York City, physicians and researchers looked for reported cases of swollen lymph nodes in homosexual men. Additionally, there were 5 instances of pneumocystis carinii pneumonia, which is not easy to be spread but is a life-threatening form of pneumonia found in men who are gay or bisexual. A report was issued weekly by the CDC and the PMM starting from June 5, 1981. On July 3, 1981, MMWR issued 26 reports of Kaposi sarcoma, a rare malignancy in both California and New York among men who were self-identified as homosexual. During the day, the New York Times became the first media outlet to report on the newly discovered strange alignment. By the end of 1981, the United States had reported 337 instances of severe immunodeficiency, and out of those, 130 patients have succumbed to the new pandemic. In the following year, a community-based group for gay was found on the same day. More than 100 men had joined the group. In addition, the virus was reported in infants through births as well as through blood transfusion. In the same year, prominent musician Patrick Caldwell died of AIDS-related complications. In 1983, at San Francisco General Hospital was opened as one of the first dedicated AIDS clinics. The clinic worked in collaboration between the hospital and the University of California, San Francisco, and it attracted staff members who were interested in HIV/AIDS. The staff gradually developed the San Francisco model of care, which emphasized the following: treating patients with compassion and respect, providing a range of health and societal services in a single location, and partnering closely with the local health department and community organizations. 17 years later, President Clinton declared AIDS as a threat, and therefore humanistic global health groups were called upon to join hands in a fight against the virus. In 2020, a report was published showing that the rate of infection had fallen by half from the year 2010 to 2017 due to the early diagnosis and HIV testing, which calls for early medication. June 5, 2021 marked 40 years since AIDS was reported in New York. Methods of AIDS and HIV surveillance. Voluntary testing, which was introduced in 1985, gave the scientific community the ability to directly measure the frequency and incidence of HIV infections in communities. HIV cases reporting continues to be the pillar upon which governmental monitoring programs are built in both rural and urban centers, most notably the Western Pacific as well as the Eastern Pacific. STD surveillance in the traditional setup relied on the passive reporting of clinically or etiologically identified STD cases. Typically, on the 2 most serious STDs, syphilis and gonorrhea, were reported. However, the recent adoption of syndromatic STD diagnosis and treatment in New York City has resulted in a modification in STD case definitions for both surveillance and case management purposes within the sex workers and the pregnant mothers. Some countries have begun to report syndromes rather than specific illnesses such as vaginal discharge or genital ulcers. The discovery of HIV rates among teenagers, together with the release of previous withheld data on the matter, um, reignited the debate on how to properly educate adolescents about sex. In addition, aware of the continuing high transmission rates among gays, CareC began assisting MSM organizations in networking and promoting safer sex and condom use. In New York City, the expansion of the Centennial surveillance to multiple regions led to the identification of an unexpected epidemic hotspot in a commercially significant area, such as the military base points as well as the tourism sites, motivated planners to develop extensive prevention plans targeted at teen sex workers, the MSM, and the general public on the geographical concentrated basis. Epidemiology of HIV/AIDS in New York City between 2009 and 2019 in New York, the number of people that are newly diagnosed with HIV declined by 45%. The rates of new HIV diagnoses were 9.7 and 6.3 times higher for non-Hispanic blacks and Hispanic individuals, respectively, than for non-Hispanic white adults. HIV prevalence rates were 8.2 and 5.9 times higher among non-Hispanic blacks and Hispanic individuals. As of 2019, 107,649 New Yorkers were living with HIV. While the burden on HIV was the greatest in New York City, 22% of people who lived outside the 5 boroughs. Out of the 107,649 people living with confirmed HIV in New York City, 75% were at least 40 years old and 56% were 50 years old. In addition, the majority of the HIV diagnosed, 67%, occurred in individuals under the age of 40. Less than 20% of newly diagnosed occurred in individuals 50 years older. In 2019, 350 HIV-positive women gave birth to 360 infants in the New York State delivery facilities. Among the infants delivered to HIV-positive mothers, 1 had confirmed HIV diagnosis and 257 had an unconfirmed HIV diagnosis status. In addition, 81 were considered to be asymptomatic and 20 had an uncleared condition. In 2019, there were 222,396 live births in New York State hospitals, resulting in 2 incidents of HIV transmission from mother to child per 100,000 live births and a 0.6% mortality rate. The predominant mode of virus transmission in New York City was reported as gay sex and through sex work. On the other hand, mother-to-child virus transmission rate was reported to have declined by about 70% in the 5 boroughs of New York City. The decline in the spread of HIV/AIDS has been spearheaded by numerous prevention measures which are being taken by the United States government as well as global health organizations. For example, the discovery and widespread use of the precise HIV screening tests, which have successfully eliminated infection from blood supply in the developed world and the majority of the developing world. Additionally, administering a brief course of nevirapine to mothers during labor and postpartum neonates decreased the risk of mother-to-child transmission by up to 47%. Recent researchers indicate, however, that such short-term gains may have come at the cost of resistance and viral failure if postpartum therapy is commenced. Due to the historic absence of antiretroviral medication in the majority of underdeveloped nations, the government lacks enough financial and humanistic to deploy a holistic strategy in curbing the virus. Pandemic control requires a two-pronged approach that promotes both caring and prevention. While increased access to treatment makes it more feasible to integrate preventive and caring approaches, which result in constrained settings. Besides, it provides the framework for considerations regarding the appropriate preventive techniques to match with already implemented medication strategies. Current coverage gaps combined with the epidemic's unrelated development highlight the critical access for ways of prevention and treatment. Inventions is a necessary recognized by the worldwide community, but not yet accomplished about more than 15 years. Along with inadequate coverage of critical interventions, probably the most significant impediment to successful worldwide control is a dearth of solid evidence-based intervention globally and specifically populations in New York City. Similar to how global policymakers increasingly recognize the importance of rigorous evaluation of development projects to assure their performance as well as avoid waste, the importance of credible scientific assessments of the pandemic controls initiatives is similarly critical for the same reasons. There are just not enough resources to do everything everywhere. Trade-offs and priorities must be established. This information gap is severe in HIV/AIDS area when it comes to HIV prevention, in population-based prevention in particular. At the moment, resource allocation for HIV/AIDS prevention measures is rarely evidence-based, owing to the dearth of information and efficacy of the program. Today, more tools for HIV prevention are available than ever before. You can employ tactics such as receiving HIV medications used for prevention, such as post-exposure prophylaxis. If you have HIV, there are numerous prevention measures you can take to avoid passing the virus to others. Thank you very much for listening to my presentation. I hope you have a wonderful day. Goodbye.